You don't notice hierarchy in a hospital until something goes wrong. From the outside, it looks coordinated. Doctors move with urgency, nurses monitor patients, machines beep rhythmically. But inside, every role carries a specific weight, and the higher you rise, the more lives depend on your decisions. You begin at the bottom, maybe as a medical assistant, maybe as a nursing aide, maybe as a hospital intern. You take vitals, transport patients, prepare rooms, handle paperwork. Your job is support. You are not making diagnoses. You are not making treatment plans, but you are learning the rhythm of the system. Hospitals operate 24 hours a day. Fatigue is common. Mistakes are not. As a registered nurse, responsibility changes. Now you monitor patients directly. Medication schedules, IV lines, chart updates, early signs of deterioration. You are often the first to notice something is wrong. A subtle change in breathing, an irregular heartbeat, a patient who looks off. Doctors may lead treatment, but nurses sustain stability. Your judgment matters, because delay costs time, and time inside a hospital can equal outcome. As a charge nurse, you oversee a unit. You assign staff, balance patient loads, coordinate admissions and discharges. You manage both care and personnel. If a shift becomes overwhelmed, you stabilize it. You handle conflicts quietly. You make sure standards hold. Because in a hospital, chaos spreads quickly. Leadership here is quiet control. On the physician path, hierarchy deepens. You begin as a medical student, observing, assisting, learning anatomy not just from books, but from real cases. Then comes residency, long shifts, limited sleep, constant supervision. You treat patients under guidance. You learn that medicine is not certainty. It is probability managed carefully. You make decisions. They are reviewed. Every error is discussed, because errors here have consequences. As an attending physician, authority becomes real. You make final treatment calls. You sign off on procedures. You supervise residents. Your name goes on the chart. If complications arise, responsibility traces upward. You weigh risks. Surgery now or later? Aggressive treatment or conservative approach? Every decision balances uncertainty. Experience becomes your most valuable asset. Department heads operate at another level. They oversee entire specialties: emergency medicine, cardiology, surgery, intensive care. You manage staffing, budgets, policy implementation. You respond to critical incidents. You handle regulatory oversight. The hospital is not just clinical, it is operational. Leadership here blends medicine with management. At the executive level, chief medical officer or hospital administrator, hierarchy shifts again. You are no longer treating individual patients. You are responsible for systems, safety protocols, infection control, resource allocation, crisis response planning. When a hospital faces a surge, pandemic, disaster, mass casualty event, decisions at this level determine survival capacity. Your authority is institutional. Your mistakes affect thousands. From the outside, hospitals look like compassion. From the inside, they are structured systems built on protocol. Every rank has purpose. Every level absorbs more pressure. The higher you rise, the less hands-on your role becomes, and the more people depend on your leadership. Somewhere right now, a new medical student is entering their first hospital shift. Believing medicine is about knowledge. It is, but only after discipline, teamwork, and hierarchy align perfectly. Because in a hospital, rank is not about status. It is about responsibility carried in real time. And in this system, hesitation has consequences. If you want to keep understanding how real-world hierarchies function where outcomes are immediate and human, stay here. This channel is built for people who prefer structure over noise.